Thank you to Artivism for inviting me. This is my first time in Artivism. This is also my first time to talk to non-medical people about COVID. And also this is my first time to share more personal views about COVID, not just scientific things. So thank you to the organizers for inviting me. I entitled my talk as COVID-19 Ongoing Battles because, well, we're still fighting this pandemic. And also, even though I don't really find it comfortable to use the metaphor of war to talk about this pandemic, there seems to be no other way of describing it because this is really the biggest challenge of our generation, the biggest challenge of our times. And so, although we encounter this pandemic in different ways and we experience it in different personal ways, we all share the effects that this pandemic has affected all of us. So let me share a short talk I made about COVID-19 and the ongoing battles that we are still fighting about this pandemic. So, of course, if you remember, 2019 was already a year of outbreaks. There was measles, and then there was that big dengue outbreak here in Iloilo, and then there's the reemergence of polio in the Philippines. And then again, before the year was about to end, on December 31, 2019, there's the news out of China of a viral pneumonia, which of course eventually became COVID-19. And in 2020, affected all of us. It became a pandemic. 2020 became a pandemic year. It affected all of us, and it turned all our lives upside down. So maybe what this reminds us is that infectious diseases will always be there, no matter how advanced our civilization becomes. Infectious diseases will always prove to be a challenge. And that would maybe give us a bit of humility because we are all part of this planet. And if we don't know how to deal with all the other organisms that share this planet with us, then we are not going to survive as a species. So, seeing that this is a totally new virus, this is a totally new disease, there was a lot of uncertainty for us doctors, but also for everybody else, because how do you treat this disease? How do you know if this is COVID-19 that you're facing, and how do you prevent it? If you remember, there was a lot of questions about rapid antibody test, which we don't use much anymore because it's not really useful for early infection. And of course, about treatment, there's the news about hydroxychloroquine, an old drug, which is supposedly used for malaria, but then had to be repurposed for possible use for COVID. But then again, after all that research, it proved to be not useful. And until now, we're still ongoing doing research for finding an ideal treatment for this. And of course, there's also a lot of uncertainty about prevention. First, if you look at it, not everyone was advised to wear masks. Border and travel restrictions were not implemented. So, and up to now, there are still a lot of questions about this because this is a totally new disease and we are still learning along the way. And so this uncertainty proves a challenge to doctors personally because first, you have to be able to know about the disease and to be updated about what are the new findings so that we can treat our patients better. But also, aside from being able to treat our patients better, knowing about the disease, knowing about the updates actually is a matter of survival. Because for you to be able to not get the disease, you have to know what are the new findings of research. And so, being vulnerable to the disease personally makes this disease go beyond professionalism. It becomes more personal. But first, of course, because you can be affected by the disease, you have to be careful. How do you treat your patient if you are sick yourself? How do you prevent infecting your patients or the people around you or your loved ones? So these are the challenges that were personal for me because I had a lot of colleagues who were affected. I had mentors who passed away because of the disease. And you can't help but feel vulnerable. But also you have to balance that with the fact that you have to be professional in terms of dealing with the disease. There's this question of what to do. Am I doing enough? Because personally, for me, when I was in Manila, I was in the emergency room, I was in the hospital, going on duty at the hospital for 24 hours, things like that. But then again, now with this pandemic year, I was not really at the front lines when everything started. But I was on call. People, our junior doctors were calling me, our fellow colleagues were calling me on what to do, on what policies to do. So eventually I realized that yes, even though I may not be at the hospital front lines, I am still doing my part. Because everybody has to do their part. I became a part of the team, writing policy papers. We were doing administrative work. We were doing research. We made clinical practice guidelines so that our colleagues will be guided on what to do with patients. So even though I initially felt like I was not doing enough, reflecting on it, it made me realize that everybody has a part to play, and I think I am doing my part by doing this administrative work. But of course, when the time came that I had to be there at the front lines, I had to wear my PPE. I think because for the cesarean delivery of a mother who initially tested positive. When I wore that PPE, I initially felt like, this is it, let's do this. But then again, while waiting for the operation to finish, fear starts to come in. You would think, what if there's a leak in the PPE? What if I get infected? What if I don't remove the PPE properly and I get contaminated? This is the kind of fear that, well, you have to face it and you have to deal with it because it is part of your job. So of course, having that fear is also a humbling experience for me because you have to realize that you're doing this not just to treat the patient, but you also have to protect yourself so you'll be able to do the rest of your profession, do the rest of what you need to do. Also, there's this matter of discrimination. Even though I myself fortunately did not experience it, it's quite unfortunate to hear about stories that instead of feeling like you're doing your part in dealing with the disease, some health workers were subject to discrimination. It's a good thing that eventually the public came around and became educated and supported our healthcare workers. Also, there was a time that maybe out of frustration, I would think that, come on, let's get the virus, let's get this over with so that I can develop the immunity and I can go on. But then again, you'll be reminded that it's not sure that you'll survive the infection. It's not sure that you'll not pass it on to your loved ones, to your patients. And so that kind of reminds you that you have to be careful still while you're doing your job. So all these stresses sometimes demands for me personally, to find distraction. Initially, I tried to watch movies and documentaries about outbreaks to maybe educate myself also, aside from distracting myself. Movies like Contagion or World War Z. But it came to a point that it wasn't really distraction that I was looking for. So I really had to find rest from all of this. For me, I found it in watching BTS, the K-pop boy band. And also with the rise of Boys Love series in YouTube, these allowed me to not just find distraction, but they allowed me to rest. And eventually, when you go back, it's not anymore just distraction. It gives you rest, but also it allows you to reflect. So for me, maybe this is where art played an important part for me personally, because it allowed me to rest, but also to reflect about all that's going on here, all that's going on around with the pandemic. And having rest, giving yourself rest, actually allows you to fight for another day and fight for the biggest battle in all of this, which is the battle for the heart of the people. Because prevention is the primary goal of public health, and that's very important in this pandemic. We are reminded again that public health and politics are linked, and they play an important role, especially in this time. So we are reminded that though we call the frontliners, call the healthcare workers as frontliners, the frontline really is in the community. Because when you go to the hospital, you're already infected. The first line of defense has fallen, because the first line of defense is in the community. The first line of defense is to not get infected. When that fails and you get infected, and then that's when you go to the hospital, and then that's when you need the help of healthcare workers. But then again, the front line should be in the community. The front line should be in prevention. And so, we again come to realize that in terms of politics and public health, it is important for the people to listen to the experts. But also, it's important for the experts to listen to the people. There are still people who deny COVID. There are people who are not fully aware about the need for personal protective equipment. So we have to understand where they're coming from, and then we have to educate. Because the COVID denialism, just like what happened with HIV denialism, will only lead to more deaths. And of course, as long as we don't control the infection, there will always be new variants that will come up. And so that will be difficult for us to control the pandemic. So because we really have to control the pandemic so that we can build back again. And then this is where the vaccine acceptance comes in. This is again the new battle for the heart of the people. We know that there's a high rate of vaccine hesitancy in the Philippines. And so communicating the importance of vaccines is important, so that because vaccines really are the best tools that we have in ending this pandemic. We have to end this pandemic so that we can build back our lives again. And in terms of building back our lives, it's good to reflect that when we finally control the pandemic, we don't just go back to how it was before. We have to learn our lessons. We have to build a better healthcare system. We have to prevent infections from turning into pandemics again. There has to be accountability for our government officials. And of course, you have to, after all of this, we really have to build back better. So let me end by just sharing these two poems that I wrote during the start of the lockdown last year. Basically, they just try to give a message of hope for all of us who are still going through this pandemic. Beauty sprouts in the most unprotected of hearts, and truth persists in the stillness of flowers. The bothered soul needs only to rest in humility. And this is my sunflower poem that I wrote when I was during the time of the start of the lockdown. Nagburubot lang ang adlaw, nagburubok kag mankaw. May galom man kag panganod, magkapabili ng iyong kahapon. Ang pagbulos ng adlaw sa gabi, padayon. Ang uman kita, padayon lang, padayon.